Back pain in golf. Sadly, why are these two things so related? Well, today we're going to talk about what might be bothering your back when you're playing around a golf, but the best part is we're going to help you analyze it and how to fix it. I'm PGA teaching professional Todd Kolb, Director of Instruction for US Golf TV, and there is nothing, sadly, that can ruin a beautiful day in the golf course sooner than having a bad back. Now, if you haven't already, be sure to subscribe to our channel and be sure to leave some comments or some questions in there, because today we're talking about something that's really important, not only preventing injury, but helping you enjoy your days on the golf course. So what I've done here today is I've brought in one of our experts here at the Sanford POWER Golf Academy. I brought in Matt. Matt, you are a physical therapist, you're a golf medical professional, you know the body, you know the golf swing. Golf and bad backs, what's happening?
Yeah, so by far and away, most common thing that we see here when we're treating golfers is back pain. Interesting thing is they come in thinking it's their back, and honestly, majority of the time, the low back is not the problem. It's somewhere else in the body.
Well, and that's what I want to talk about today, because I know the golf swing, but I don't know the body nearly like you do. So what I want to do, because I want to get right into this, folks, we want to get some answers right away. So I'm going to make a backswing, and I want you to kind of walk us through, if I'm feeling lower back pain, what else might be happening? So let me go ahead and get set up here. I'm going to take it to the top.
All right, so in the backswing, to get into this position, what needs to occur, we need to have a fair amount of what we call thoracic rotation or upper body rotation. Also key to have, to make a good pivot, we need to have a fair amount or some good hip rotation there. Now what happens if one of these two is not doing what they're supposed to do, the low back is always, it turns into the nice guy and it tries to take over and do the job of one of these two areas. Well, that tends to cause problems. It's going to lead to pain, stiffness, tight low back. So we'll get into some other things why that's happening.
Well, when we're talking about this is maybe not, well, maybe it is related to lower back injury, but even from a golf standpoint, I want to show you something that I see a lot in golfers, and you can tell me if maybe this is because of their hips. So I see a lot of golfers, they get in here, Matt, and they got a pretty good swing. Then they get to the top, and they actually do something that looks like this. It looks like they're turning, but they're working more like this. What's happening when they do that?
Yeah, definitely. So we see that a lot, like you say, and we would call that reverse spine angle, or they're getting into too much extension. And again, that may be because their upper back, their thoracic spine isn't quite rotating, their hip is an issue, or we look at other keys like the core strength, kind of glute weakness isn't firing, so they're trying to get to that position and they're just extending through the back, kind of pinching down into their lumbar spine or lower back.
Now I see that a lot with even we think of back pain as for just older people, but I see that a lot with young golfers too. Why might that be where they get in that position?
Yeah, and that's where it's key, getting your body screened. So it's funny, the older golfers we see a lot of times it's the mobility issue, their upper back or their hip. If we're talking junior golfers or someone who has good mobility, it may be like core weakness. That's usually the third culprit if those first two aren't involved. And that's where we just need to figure out, do we need to build up some strength and some postural awareness to help limit that lower back from taking over the swing.
Yeah. So all right. So the first thing we're learning right here, this is fantastic, is that if your lower back is bothering you, it might not actually be your lower back. We want to start looking looking at some other areas. All right. So let's get into some of the specifics we can do here at home.
Perfect. So if we talked about the three common things, our thoracic spine or upper back, second one would be the hip, and third is maybe some core strength weakness. So the first exercise that I would have someone do is simple thing that they can do at home. Find a wall. All you really need is a foam roller or a pillow, something that you can push your knee into the wall. What that's going to do is stabilize our lower body. Then I'm going to have you work on just rotating through your upper body, teaching your body how to move that upper spine, or maybe it's locked down, so you need to stretch it a little bit with that movement. Over time, that's going to help your body be able to move your hips, your upper back independently of each other and try to take some stress off that low back.
That's one of my favorite movement patterns you guys do, is because, folks, that can help you not only obviously with, we're talking about here with your back pain, but also just in general. Even if your back is not bothering you, that's a great thing to do because you're creating some awareness of how to rotate. All right, number two.
Definitely. Number two is a simple thing, what I call the 90-90 position. And what that's going to do is that's really going to stretch out your hips. So we're going to work at trying to open up those hips, create a little bit more mobility, to be able to rotate in that backswing and that downswing, which is going to take stress off of the joint above, which is our lower back. That's usually the one that's barking or in pain because the joint below it isn't doing what it's supposed to.
Yeah, so those are the first couple, some great things, easy, simple things to do. Number 3.
Yep. Number 3 is we're gonna work on the core strength. So we're actually going back to the first exercise that I showed you, and now we're just adding in a little bit of a weight using a med ball at home or maybe some light dumbbells. You're rotating into that pattern, but you're having to hold a little bit of weight, and that's gonna cause your core to stay nice and stable and build some strength through there to give you a stable base.
Perfect. Hey, golf is a great game. We want to be playing it as long as possible. Back issues are not just for old people or young, it's everybody.
No, everybody.
All right, everybody.
Yep.
So here's what I want you to do. Next time you're heading to the golf course or just in general, if you're having some issues, find a physical therapist, find somebody who's certified like Matt, who knows what they're talking about when it comes to not only the body but also the golf swing. Your golf instructor might be a good help for you. Take these things that Matt has shown you. You can do them at home. You can maybe even do them on the driving range before as a warm-up session. And if you do those things, you're going to alleviate some of that back pain, but more importantly, you're going to get a chance to spend more time on the golf course, which is exactly what we want.